This is the demonstration for hip flexion. The normal range is 0 to 120 degrees. The starting position is supine. The axis of the goniometer goes on the greater trochanter of the femur. The movable arm of the goniometer goes along the longitudinal axis of the femur, pointing toward the lateral epicondyle. The stationary arm of the goniometer is parallel to the mid-axillary line of the trunk. The client will now perform hip flexion by flexing his hip with his knee flexed.
Okay, so he's at about 120 right now. So I'm going to push him a little bit for passive range of motion. And he's at 132, so get a little bit extra there with passive.
The muscle used in hip flexion is the iliopsoas. So iliopsoas is not palpable. To test the iliopsoas against gravity, you start with the client in sitting with their non-test leg resting on a chair. The therapist's hands go on the ipsilateral iliac crest, and resistance is applied just proximal to the knee.
All right, push up for me. Keep going, go. And down. Okay, so he's a 5 out of 5. He has full strength with maximum resistance. If he could not do a 5 out of 5, we would do gravity eliminated. So can you lay down on your side that way for me?
The therapist will support the weight of the lower extremity.
Hip extension. The normal range is 0 to 30 degrees. The client will start prone. The axis of the goniometer will be placed on the greater trochanter. The movable arm will be placed on the longitudinal axis of the femur, pointing towards the lateral epicondyle. The stationary arm will be parallel to the mid-axillary line of the trunk. The client will now extend their hip with their leg straight.
Okay, she's at 25. Passively, I'm going to get her to about 33.
Next, we are going to do manual muscle testing. The muscles being tested are the gluteus maximus and the hamstrings, which include the biceps femoris, the semitendinosus, and the semimembranosus. To test against gravity, the client is going to be prone. The hand will be on the small of the back and resistance proximal to the knee.
For the purposes of this video, I'm going to relocate to behind the table so that you're able to see the motion better.
The client will now extend their hip with their leg straight.
She was a full range of motion against maximal resistance, which is a 5 out of 5.
If the client cannot perform the entire movement against gravity, we will move to gravity eliminated, which will be side lying on the non-test side, and the OT will support the weight of the lower extremity.
Move back for me, and forward.
We are now going to be demonstrating hip abduction. The normal range of motion is 0 to 45 degrees. For a range of motion, the client will start in the supine position. The axis of the goniometer goes on the anterior superior iliac spine of the test side. The stationary arm of the goniometer goes along an imaginary line between the two anterior superior iliac spines. The movable arm goes parallel to the longitudinal axis of the femur. The client will then abduct their leg.
Okay. He is at about 40 degrees passively. I can get him to about 47 degrees.
For manual muscle testing against gravity, the client will be side-lying on the non-test side with the non-test leg flexed. The hand is just above the iliac crest, and resistance will be applied just proximal to the knee. The muscles being tested are the gluteus medius and the gluteus minimus. These muscles can be palpated distal to the lateral lip of the iliac crest or proximal to the greater trochanter of the femur. The client will then abduct their leg.
Push up for me. Up, 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 up. And down. Good. So that was full range of motion against maximal resistance, which is a 5 out of 5.
For gravity eliminated, the client will be in supine position, while the therapist supports the weight of the lower extremity.
Okay, put your leg out for me again. Go, 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 go. Good.
We are now going to demonstrate testing for hip adduction. The normal range of motion is 30 degrees. For range of motion testing, the client will be supine with the non-test leg hanging off the plinth. The axis of the goniometer will be placed on the anterior superior iliac spine. The stationary arm will be placed longitudinal to the line connecting both anterior superior iliac spines. The movable arm will be placed parallel to the longitudinal axis of the femur. The client will then adduct the hip.
She is at about 25 degrees, and passively, I can only get her to about 27.
For manual muscle testing against gravity, the client will be side-lying on the test side. The muscles being tested are the adductor longus, adductor brevis, the adductor magnus, the pectineus, and the gracilis. Stabilization by the therapist is given on the iliac crest. The client will then adduct the hip against gravity. Then resistance by the therapist is given just proximal to the knee.
Up, 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 hard, and down. Good. She is a 5, so she's against maximal resistance.
The gravity eliminated position for this motion is supine, with the therapist supporting the weight of the lower extremity.
Hanging up here. Just have you come over here. Good.
We are now going to demonstrate testing for internal hip rotation. The normal range of motion is 45 degrees. For range of motion testing, the client will be sitting with the bolster under his knee. The axis of the goniometer will be placed on the midpoint of the patella. The stationary arm will be placed perpendicular to the floor. The movable arm will be placed parallel to the anterior midline of the tibia. The client will then internally rotate his hip.
Okay, he is at 37, and passively I can get him to about 45.
For manual muscle testing against gravity, the client will be sitting with his non-test leg supported on a chair. The muscles being tested are the gluteus medius, the gluteus minimus, and the tensor fascia lata. Stabilization by the therapist is given on the knee. The client will then internally rotate his hip against gravity.
Bring your foot out. And back. Good.
Then resistance by the therapist is given just proximal to the ankle in opposite direction of the motion.
Push against me. And back. Good. He is a 5 out of 5 against maximal resistance.
The gravity eliminated position for this motion is supine with the hip at 90 degrees with the therapist supporting the weight of the lower extremity.
Okay. Do this motion for me. Good. Good.
We are now going to demonstrate testing for external hip rotation. The normal range of motion is 45 degrees. For range of motion testing, the client will be sitting with a bolster underneath the knee. The axis of the goniometer will be placed on the midpoint of the patella. The stationary arm will be placed perpendicular to the floor. The movable arm will be placed parallel to the anterior midline of the tibia. The client will then externally rotate the hip.
Okay, he is at about 40, and I got him to 45, passively.
For manual muscle testing against gravity, the client will be sitting with his non-test leg supported on a chair. The muscle being tested is the piriformis. Stabilization by the therapist is given on the knee. The client will then externally rotate his hip against gravity.
Okay, good.
Then, resistance by the therapist is given just proximal to the ankle in the opposite direction of the motion.
Good, and down. He is against maximal resistance, so he is a 5 out of 5.
The gravity eliminated position for this motion is supine with the hip at 90 degrees with the therapist supporting the weight of the lower extremity.
Okay, externally rotate for me.